Thank you for joining us. My name is Dave Hamby. I am Communications Director for the Oklahoma Policy Institute. On Tuesday, Oklahomans will go to the poll for a statewide primary, and also on the ballot will be State Question 802, which would provide full Medicaid expansion in Oklahoma to provide coverage to low-income residents. For this episode of Ask Oklahoma Policy, we wanted to take a look at the state question and its implications. So today we are joined by Carly Putnam, who is our Policy Director and Healthcare Policy Analyst, to talk about the key issues related to State Question 802. So good morning and welcome, Carly.
Hey, I'm excited to be here.
All right, well, the first question we're going to start off with is a pretty basic one, which is, can you tell us what is Medicaid expansion?
So in the simplest way of saying this is that Medicaid expansion is access to a quality, affordable health insurance for hundreds of thousands of low-income working-age adults in Oklahoma who would have health insurance if they lived in 36 other states or DC. States have the option to expand their Medicaid programs, hence the term Medicaid expansion, to include low-income working-age adults who generally don't have other access to health coverage. They earn too little to purchase it on the marketplace, and they work jobs that don't offer health insurance at all. It's a state-federal partnership with the feds offering a 90-10 match in federal money for Medicaid expansion. So if states expand coverage, for every dollar that the state spends on expansion, the federal government will pay 9. That's an incredibly high match, and it's meant to be an incentive for states to take this on. Typically in a Medicaid program, it's about a one-third, two-thirds split. So for every dollar the state spends, the feds spend 2. So to have a 9-to-1 match in Medicaid expansion is just phenomenal. And because Medicaid expansion has been available across the US for a number of years now, we've had the opportunity to see the effects that it can have in other states. So at this point, it's a well-known quantity, and it's exciting that Oklahomans finally have the opportunity to vote on it.
All right, thank you for that. Now, can you help us connect the dots to how Medicaid expansion is tied to State Question 802?
Sure. Advocates have been working to try to get a legislative Medicaid expansion passed in Oklahoma since it first became available back in 2013. But the legislature has proven unable or unwilling, or some combination thereof, to really move forward on this, even though we've seen the pretty remarkable results of expansion in other states. A couple years ago, Maine, then followed by Utah, Nebraska, and Idaho, citizens there said, if the legislature isn't going to do this, we will. And so in all 4 states, Medicaid expansion has passed on the ballot. And now Oklahoma now has our chance to finally do what we've been needing to do for a long time and bring our federal tax dollars home.
All right, thank you for that. So let's turn from there and look at the financial implications for State Question 802. Mm-hmm. Is the expansion of Medicaid coverage something that Oklahoma can afford to do?
It's something we can't afford not to do at this point. From what we've seen in other states, all the evidence is that Medicaid expansion effectively pays for itself. Oklahoma right now is still paying for healthcare for people who are uninsured, but we're doing it in the least efficient, most traumatic, most expensive way possible. We also have folks who right now are getting some kinds of healthcare through the state, for instance, mental health or substance use disorder services, where those services are being paid 100% by the state, and they're only getting treatment for those behavioral health conditions, not for any other health issues they may have. So if the state expands Medicaid, many of those people are going to be able to move over from having part of their health needs addressed fully by the state to having all of their health needs addressed at a 90-10 match. We've also seen that Medicaid expansion is pretty remarkable for rural hospitals. A study that came out earlier this year found that of the 10 states with the most rural hospital closures, all 10 were non-expansion states. Expanding Medicaid does a lot to help keep providers afloat, especially those lifeline providers in rural areas, where if there's an emergency, you want to know that you can get care as quickly as possible. Medicaid expansion also has a multiplier effect. So when the state expands Medicaid and people get access to health care, that creates then more jobs in the economy and more spending in the economy. A report coming out today from Families USA says that it'll be an overall economic impact of about 2.3 billion, and I believe 26,000 jobs created just by Medicaid expansion.
One of the questions we get a lot is, how does full Medicaid expansion that is included in State Question 802 compare with what the governor came out with earlier this spring with his proposal, which he branded SoonerCare 2.0?
The expansion authorized by State Question 802 is the most effective, most efficient way to expand Medicaid. And as I said, we've seen 30 some other states already do this. We have a pretty clear indication of what works and what doesn't. And making sure that the eligibility enrollment process has minimal red tape and is as effective as possible means that when people enroll, the healthcare dollars are going to get them healthcare, not to create unnecessary bureaucracy. By comparison, SoonerCare 2.0, the governor's Medicaid expansion proposal alternative, would do almost the opposite of that. It would institute a number of barriers to care for people who need this healthcare, requiring them to essentially be very good at paperwork in order to keep the health insurance that they need. We also don't know what the status of the governor's plan is right now. After he unveiled SoonerCare 2.0 this spring, he submitted all of the plans off to Washington, D.C., and then he vetoed the bill that would have funded year one of it. His plan had 2 phases, and he vetoed the first phase. And he's not actually said what his plan is going forward, which I think really clearly illustrates why State Question 802 was necessary in the first place. The governor and the legislature have had time and time again been able to pass a legislative expansion, and they just have not been able to. So State Question 802 is very much a sure thing.
Thank you. Our last question for this session is, can you help us better understand who would be impacted by the decision to expand Medicaid in Oklahoma?
Sure. So I'm going to start with the really obvious answer, which is that Medicaid expansion would help the people who enroll, which would be a couple 100,000 low-income, working-age Oklahomans who don't otherwise have access to care. The majority are childless. Some are parents who fall into what we call the coverage crater, where they earn too much to qualify for Medicaid in Oklahoma right now, but not enough to purchase subsidized health insurance on healthcare.gov. And we've seen from other states that when people get coverage through Medicaid expansion, they just generally do better. Their financial security in their household improves. They're more likely to get all necessary screenings and treatments. We're beginning to see the impact on health outcomes, especially in beginning to help close the racial healthcare gap. So we've seen that in conditions that particularly plague women of color, for instance, we're seeing fewer children, fewer babies born at low birth weight. In southern expansion states, we're also seeing across the board decreased mortality and slowed health declines in older adults, increased access to badly needed mental health treatment or substance use disorder treatment. I feel like it's gotten somewhat lost in the shuffle over the last couple months, but there also still is an opioid epidemic going on. And people are more likely to be able to get access to care for substance use disorder if they're enrolled in Medicaid. There's also a couple of groups within the expansion population who particularly benefit. One is American Indians and Alaska Natives. So there's this popular misconception that people who get health coverage through IHS just get all of the health insurance they need, that Indian Health just covers everything. And actually, only having access to IHS is not actually counted as being insured by the Census Bureau, because that coverage can be so at best intermittent and not comprehensive. So when Oklahomans are able to enroll in Medicaid, it not only helps them get the care they need, it also helps to put federal dollars into tribal healthcare systems, really strengthening needed healthcare in rural areas. It's also really good for people with disabilities. We know that employment rates for people with disabilities go up when Medicaid expansion becomes available. Generally, we know across the board that people who are working find it easier to keep working, and people who aren't working find it easier to look for work when chronic conditions or disabilities are better managed through access to healthcare. We can also expect Oklahoma's child uninsured rate to decrease. And This can be a little bit of a surprise to some folks. Most kids in Oklahoma who are uninsured probably do have some form of healthcare available to them, but often if their parents don't, those kids are still likely uninsured because their parents simply just don't know. So when we open avenues to coverage for parents, we not only get Oklahoma adults the healthcare they need, we're more likely to get their kids the healthcare they need to. And then finally, Oklahoma's uninsured rate is higher in rural areas. We know all about issues with struggling healthcare providers and hospitals in rural areas. And so expanding Medicaid means that whether you are or are not currently uninsured in rural Oklahoma, you're more likely to be able to go to your local hospital or see a local healthcare provider.
All right. Thank you, Carly, for that explanation. And that was our last question. So we appreciate you joining us today to be able to help Oklahomans and voters better understand the issues that they'll be facing on Tuesday. So for our viewers who want to learn more about the issue, we have posted a nonpartisan information and resources section on our website at okpolicy.org/SQ802. And you'll also be able to find that link in the description below. We encourage all Oklahomans to participate safely in Tuesday's election. And as a helpful tip, if you are voting in person, make sure that you check with your local county election board to make sure that there haven't been any changes for your local polling place. And as always, to stay up to date on important issues in the state, we encourage you to follow us on social media. You can find us on Facebook and Twitter and Instagram. Or you can subscribe to our emails and advocacy alerts, which you can sign up for at okpolicy.org. Thank you for watching, and we hope you have a good rest of your day.